Well, let's talk about cholesterol a little bit. That's a topic that keeps coming up. In 2022, I still have so many people ask me, "What about your cholesterol?" And I just say you're asking the wrong question. I don't think that's the right question. When somebody asks me, "What's your cholesterol like?" I think you're not asking me. I'd rather you ask me, "How's my heart?" Which would be, or "How's my cardiovascular health?" That would be a better question. But how do you sort of, again, I did an interview with a guy who set up a lot of the pharmaceutical stuff in the UK, and he just thinks that it's not particularly helpful to lower cholesterol in most people. Are you of that sort of belief, or where do you fall along the line about dealing with dyslipidemia, or quote unquote dyslipidemia with high cholesterol, high LDL cholesterol, especially?
Yeah, Sean. So that is the right question. So we get that all the time. A patient comes in, and so I'm concerned about heart disease and what's my cholesterol, and it is indeed the wrong question. And so, unfortunately, the Heart Associations a half a century ago really conflated this idea that LDL cholesterol was not only the single measurement of health, but also a single measurement of heart health. And so the goal was to get that as low as possible. And if you got it down to, say, zero, with some of the newer medications, the PCSK9 inhibitors, they're trying to just like eliminate LDL cholesterol from the blood. You're gonna live to forever. And the problem is when you actually look back at the um, going back to even the work of Framingham, the original heart studies, to see what this association is between LDL cholesterol and heart disease, the association is rather weak. And then when you take it a step further and you go look at the data for cholesterol lowering medications such as statins, um, and heart disease risk, again for primary prevention, the evidence is really rather weak to support. In fact, the Jupiter trial is a classic that goes back into the 90s. That was a classic study that basically told us as healthcare professionals that they should put statins in the water like fluoride. Uh, and so we when you really look critically at it, you're not really impressed. In fact, in the Jupiter trial, when you start to look at all cause mortality, in other words, dying from other medical causes, um, it seems that the um, the mortality started to rise. But in the study, and this is really a classic, they cut off the study at the point that they see that there's a small benefit to the statin. And so they don't take it out any further to see if there's any mortality benefit. So we actually share this type of information with their patients. And we say, like you just said, the risk is heart attack, stroke, uh, uh, cardiovascular disease itself, not necessarily what's my cholesterol concentration, my LDL concentration. And so, in terms of the risk, we try to redirect it in terms of not necessarily looking at LDL, but looking at the quality of the cholesterol through the ratios, looking at particle size, looking at inflammatory markers, looking at a degree of insulin resistance or not insulin resistance, and heart imaging. And the patients understand.
Yeah, there was a study I think came out in early 2021. I think it was based on either the Women's Health Initiative or Women's Health Study. I can't remember which one, but and they ranked the risk factors, and LDL cholesterol I think carried like a 1.3 hazard ratio, whereas diabetes was something like 6 or 10 or something like that. It was almost a magnitude of difference. And so now when people ask me, they talk about their cholesterol and it's high, and then you say, well, maybe you should get a CAC score, maybe you should image things, maybe you should look at these other risk factors. But really, I mean, we should be looking at people that have pre-diabetes or insulin resistance, and those are the people we should be like immediately saying, hey, you are the guys that need to be having this cardiovascular workup.
Absolutely. So a 10x risk if you have diabetes compared to looking at an elevation in cholesterol. And so we focus on these other metabolic markers, and you really have to get a full picture to understand what's going on.
How often are you recommending sort of plant-based diets? We hear that that is that's the only the only proven way to reverse heart disease. At least the claims are being made on data from Ornish and Esselstyn. Do you find that to be compelling to you? Is that part of your calculus for a significant part of your patients?
Well, look, the whole argument about plant-based diets, which is just the new term for vegetarianism, is again based from a half a century ago with the dietary guidelines to lower LDL cholesterol and to eat a low-fat diet or a diet that's low in red meat. And again, we don't really find much of a basis for it. And look, we understand we want to be, ethically treat animals and the environment and the factors all come into play there. And I always tell my patients it's like a tripod. There's three things to consider. There's the ethical treatment of animals. There's the environment and our health. And so, unfortunately, I sometimes think people look. Kind of weight these things differently, our health is an important factor, and so we're omnivores, we're opportunistic in terms of what we can eat. So I recommend plant-based and animal-based to our patients. It can be a variety, but certainly I really struggle with a vegan type of diet because it's so void of nutrients. But we actually have a community, Sean, of low carb vegetarianism, and it's a bit of a challenge, but it can be done. But these individuals, they consuming dairy. That's where they get the source of protein, and we have a discussion with them about the benefits of animal protein, and perhaps some of these individuals can add some egg to the diet, maybe some fish and chicken. And so that's as far as we go with it.